Today is International Safe Abortion Day, and the International Campaign for Women's Rights to Safe Abortions is calling on all countries to remove laws and policies restricting access to safe abortions. In South Africa, abortion has been legal since 1996, when the Choice on Termination of Pregnancy Act was passed, but stigma and a lack of information still lead to women obtaining illegal and unsafe terminations. Let's unpack this issue for you now. Joining us to discuss this is a community service medical doctor, Dr. Vikar Singh. Also with us is safe abortion activist Omolemo Molahloe. To both of our guests, thank you so much for your time this morning. Omolemo, I want to begin with you as a safe abortion activist. We've got all of the laws in place, but the stigma around termination of pregnancy in South Africa. What's it like in terms of the work that you do on the ground?
Okay, with the work that I do and the way people perceive abortion, people automatically just assume that nurses and the healthcare professionals, are judging them. But I think we still haven't opened up a lot to termination of pregnancies, because people are still running away to come into us for safe abortions. So, because we haven't experienced much of a lot of people coming, but instead people still go backdoor to do abortions, and they come to us to come to us, and then when they are in need of help, because they injure themselves, because it's very dangerous. So they still come to us and go ahead and say, okay, this is what I wanted to do, but it didn't go through because it's not safe to do it backdoor, and people are still not coming through. Yeah.
Dr. Vikar Singh, I want to get your take on this, but first, give us a sense of the work that you do in the sector.
Okay, so good morning to everyone, and thank you for highlighting this, important discussion on International Day for Safe Abortion. So currently, I'm a community service medical officer in KwaZulu-Natal, and from the time that I've been a medical student, I've always been an activist. So my background is in activism with regards to access to safe abortion services. But now as a medical practitioner, I'm now in the forefront of actually making abortion more accessible in the sector that I'm working in. So I work in a clinic, and I'm able to refer patients safely to facilities that are providing, termination of pregnancy either in the public or private sector. And I also work in a casualty where we treat and manage patients that come in for either miscarriages or for women that come in with unsafe abortion complications.
So the issue of stigma is a big one, specifically when you talk about the issue you've just mentioned insofar as unsafe abortions is concerned. What's your experience of the kind of stigma that still surrounds termination of pregnancy in our country, even though we do have the laws in place?
So for me, I like to separate stigma firstly with regards to stigma within communities and stigma within the healthcare sector, specifically. So in previous years, I have interacted and I've worked with numerous abortion providers, around the country and in KwaZulu-Natal. And what I've noticed is that there is still great stigma within our healthcare sector where, healthcare providers that want to provide termination of pregnancy are oftentimes, called bad names or treated badly by their colleagues or even people from their families or even from religious sectors as well. So I think there is still a lot of stigma even within our healthcare sector, within healthcare practitioners who want to provide the service.
Yeah. And of course, the safety around having safe abortions, the threat to life of having an unsafe abortion or a backdoor termination of pregnancy. I mean, that needs little explanation. Omolemo.
Okay, for me, I have done an abortion before, And also, when I did my abortion, I realized that a lot of people are pushed into backdoor abortions by actually the people that they seem to like be close to. Because when you decide to have an abortion, you have to like for me, I told my friend, it was not a secret because I've always like been pro-choice, you know. So I told my friends, you know, and I told people close to me, I told them that, hey, this is what's happening. I don't want to keep the baby. But other people had an opinion. They said, no, but then why don't you just keep the baby? Other people were on about religious reasons. Other people were on about culture, you know. Yes, and that's where a lot of people are pushed into unsafe abortions. And you know, I don't know, but it really just it hurts me because, you know, I wanted to do my abortion at like a private institution, but my doctor was very good to me. He said to me, no, you know what, don't do it there. Just go to a public hospital, because I was shook. Because the stigma almost also affected me. Because I was a nursing student back then. Now I'm a professional nurse. And so like, my friends were like, Haibo, what if you end up working there? You know? And I said, but then because I knew the confidentiality of what I was doing, I ended up going, you know. And also it's like other people make it about the money, but honestly, we have like safe abortion institutions for free all over the country, in Cape Town, everywhere. So yeah, that's.
Was it difficult for you to be open with your family and even to be open about your abortion now in our conversation? Was that a difficult step for you to take?
It wasn't a difficult step for me. To be honest, my abortion, like when I did it on the day, I was very excited. I've never kept it a secret from onset. I've never said, oh, I've never felt bad about it, because it's something that I've always, like, I wanted to do. Because, you know, like you would talk about things, right? You would talk about, like getting pregnant. You know, you never know that it's going to happen to you, you know? And when it happened, I said, but then I've always said, this is what I will do. And then that's what I did. So for me, it has never really been difficult, because also for me, pregnancy was very personal. I made it about me. Like when I decided to have my termination of pregnancy, it was about me. I cut off all the other factors which are external, because at the end of the day, it could be your boyfriend or whoever made you pregnant, your parents. They might wanna say, no, keep the baby, but it's up to you what you do. It's you who will end up being with the baby at the end of the day. The external factors might fall off, but it was never hard for me to like say to people, disclose it to people that, oh, I did. I always even said, I say it out loud, because me, I want, when you talk to me and say, Omolemo, I'm pregnant, I want you to feel comfortable. Like if I tell you now, no, you know what, this is what you can do, you shouldn't feel bad. Because for me, I didn't have anyone with experience around me of having a TOP. So everybody would say, oh my gosh, it's gonna hurt. Oh my gosh. And to be honest, it didn't hurt.
All right, I'm gonna ask both of our guests to stay with us. We're gonna take a short breather on this World Safe Abortion Day. Continue to unpack some of the other important issues for you. Don't go away. For you this morning on this World Safe Abortion Day, we're still in conversation with Dr. Vikar Singh, who is a community service medical officer. Also with us is safe abortion activist Omolemo Molahloe. And Dr. Singh, I want to talk to you about the issue of safe abortions. And I think for many people who are pro-choice, it might be in some respect an easier situation when a termination of pregnancy comes perhaps after a rape, perhaps if there are complications with a pregnancy. Is it difficult in your experience for people to understand the choice of a woman of what to do with her uterus, and abortion that is not due to any of the reasons I've just listed or due to medical reasons?
So according to our Choice on Termination of Pregnancy Act in South Africa, abortion is legal on request up to 12 weeks of gestation, and thereafter until 20 weeks, depending on specific circumstances, some of them that you mentioned. I think from my experiences with other colleagues and medical practitioners, I feel sometimes people are more sympathetic when women come forward requesting a termination of pregnancy, you know, in cases rape or incest. However, when it comes to women, coming into a facility, requesting it, within the first trimester, on request as per our abortion legislation in South Africa, people are a bit more apprehensive. And I think we need to prioritize the autonomy of women more in the country, and that we need to be able to make the service accessible because it is legal. A lot of healthcare providers sometimes are even barriers themselves for women to access, abortion services. And I think discussions like this, like the one we're having this morning, is important to demystify myths, to create that discussion so that we can bring down, stigma within our communities and in the healthcare sector.
So you're saying even in the healthcare sector, when it is a woman who's requesting a termination of pregnancy based purely on the fact that she does not want to be pregnant, not on any other extenuating circumstances, she chooses not to want to be pregnant, they have difficulty accessing that service?
So I think over the past few years, the Department of Health has tried their best to improve access to abortion services in the country, and specifically in KwaZulu-Natal as well. However, within our law, we do have a clause there which speaks about conscientious objection and, healthcare providers, objecting to providing the service. According to the law as well, it states that if, for example, myself as a healthcare provider, if I conscientiously object to providing the service, I should be able to refer the patient to another provider that's willing to. But what I've noticed is, especially in peripheral areas, referring a patient to another facility can sometimes be, up to 20, 30, 40, 50 kilometers away. And that in itself can also be a barrier, in women accessing the service, especially when there are financial constraints with regards to travel and other aspects as well.
Yeah, it's one of the many issues that feed into the numbers we are seeing in terms of unsafe abortions. In fact, the UN saying that unsafe abortions are killing tens of thousands of women every year. Omolemo, how do our numbers fare here in South Africa? Do you have that kind of information available?
I don't have that kind of information available, but from where I used to work, I used to see a lot of women coming and then they damaged their uterus because they went to have an unsafe abortion. But I don't have the exact numbers to say like how many women are dying from unsafe abortions. Yeah.
Dr. Singh, is that something that you can talk to us about from your vantage point? Perhaps you can even focus on the province where you work in KZN. So
in Africa, if we look at this problem, on continental level, approximately 9% of maternal deaths are due to unsafe abortion. And when we zoom into Southern Africa or in South Africa, before the Choice and Termination of Pregnancy Act, was passed in 1996, we saw about a 91% drop in maternal, deaths related to abortion. However, from my experiences now, is that even though women may not be dying from unsafe abortion because it is legal in South Africa, there are still many women that are presenting to healthcare facilities with morbidity or with complications from accessing unsafe abortion. When we're looking at the number of facilities, for example, in our public healthcare sector that are providing termination of pregnancy, we don't have an exact, directory of it from the Department of Health, but from a report from Amnesty International a few years ago, we saw about 200 facilities, public facilities in the country actually providing termination of pregnancy services.
To both of our guests this morning on this incredibly important issue on World Safe Abortion Day, Dr. Vikar Singh is a community service medical officer. He joins us from KZN this morning, and Omolemo Molahloe is a safe abortion activist. Thank you to both of you for your time. 9% of maternal deaths on the continent, in fact, due to unsafe abortions. The UN telling us that unsafe abortions are killing tens of thousands of women every single year. An important issue.